Good afternoon. My name is Dave James. I'm a fourth year student at the Sonoran University of Health Sciences School of Naturopathic Medicine, formerly the Southwest College of Naturopathic Medicine in Tempe, Arizona. I am presenting to you all today on behalf of the Rick Scalzo Institute for Botanical Research here on our campus in Tempe, Arizona, on a research project, a deep dive into investigating lymphatic disorders, malignancies, and naturopathic management that we did in conjunction with the Pink Ribbon Lymphatic Massage. They also have a nonprofit. They provide palliative care to patients that are recovering from breast cancer procedures, but all surgical procedures. And they're also located here in Scottsdale, Arizona. We're joined today by Amy French, who's a licensed massage therapist and certified lymphedema therapist. For any questions that I might miss at the end, we've posted this poster for you all to zoom in on in a PDF form. For the AANP participants. So why did we choose lymphedema? Because this is like the perfect naturopathic condition that we can use all the tools in our toolbox to try to treat this condition. There is no cure currently for lymphedema outside of some clinical trials out in Boston where they're doing some microvascular surgeries for the primary lymphedema patients that are born with it. But most of the patients, as you can see here, 1 in 5 women treated for breast cancer are afflicted by breast cancer-related lymphedema. And physical medicine is huge in the treatment of lymphedema. So you all remember from naturopathic medical school, the lymph system is the immune system, where the immune system meets the cardiovascular system. So lymph returns to the angle where the superior vena cava comes into the heart, with the left brachiocephalic meeting the left subclavian to form the left jugular area junction there. Sorry if I missed that from an anatomical perspective. But the prevalence of cancer-related lymphedema, as you can see up on the top left here, most of it's head and neck, which is surprising, even though that's a much more aggressive but less common cancer. So most of the patients, I believe, that are seen in Amy's practice in Scottsdale are breast cancer patients, because it's just like 1 in 8 women these days. But you can also get lymphedema through your inguinal lymph nodes. So your legs could swell, or your arms, and it could be bilateral or unilateral. The gold standard lymphedema treatment, if you look it up on UpToDate or any of those Medscapes, is complete decongestive therapy. And I think why we wanted to do this poster is to just stress the importance of finding a trained, certified lymphedema therapist in your area, because anybody on the street corner can say that they provide lymphatic massage, but there's dangers if you don't do it properly with the lymph channels. You could actually kind of do more harm. In one of those first mottos of our profession is do no harm. So we wanted to point out some of the botanicals down here that have shown really good efficacy, like calendula, and some of these that you all can read over, and also what it looks like once the patients are bandaged. A lot of times they sleep with these compression garments on, so it can be uncomfortable at times, and then they also wear them throughout the day. I've shadowed some of the Fabnos across North America, and I can tell you that this is fairly common. A lot of patients are showing up in offices with secondary lymphedema. And I think we can offer a lot as naturopathic providers to increase the quality of life for these patients. And it all starts with like a mental, emotional approach. Let them know that the patients are heard. Even if you might not experience this condition yourself, you can still be there for them, to listen to them, try and hook them up in network with a lot of insurances will pay for this if they go for like a trained physical therapist or PT assistant. So we can help with kind of the networking to get them into this service, even if, you know, in office, all we were trained with is like dry brushing, right? Or like some like cleavers, teas and stuff, which have good efficacy for sure. You know, we don't want the patients to get to the level you can see here. We went through the levels of lymphedema where they get into the level where it could be dangerous and it could impact the compartments. Not quite like compartment syndrome, but if you get the rigidity in any of the extremities, that could be a dangerous avenue. On the poster, we talked about lipidemia a little bit, which not an official ICD diagnosis, millions are affected. And the stigma behind that when you have maybe a BMI that's elevated and your patient's they're trying through diet, they're trying through lifestyle, and they're just afflicted with this extra adipose tissue to hold space for them and work with them. You'll ICD-10 it in states that are licensed under lymphedema most likely. But it is a real issue out there, and there are like really good support groups that you can help your patients find. There is lymphedema that's secondary to infections. Actually seen some of those down here at the Neil Rorden Center for Regenerative Medicine. While you don't necessarily want to acupuncture directly into the lymphedema itself for risk of infection, possibly with like any skin, you know, staph or anything that's around there, there are some really good protocols that we have found right in the middle underneath here for acupuncture points for lymphedema that you all are welcome to look at here. And also fascinating, some traditional Chinese medicine herbal tea pills that treat yin deficiency, which goes kind of side and side with the idea of if most of this patient population is your perimenopausal to induced menopause from like any sort of SERM therapy like tamoxifen or something, if they're on the 5 or 10 year, even if they're on the baby TAM, right? So there's some good studies that we linked there for some of these T pills. I know this is AANP, so we can't talk about any specific brands of compression garments, but there are some amazing ones out there. A lot out of Australia also provide some UV protection, which is a big deal for these patients that want to be out, want to be active. Just last week, I was up at Seattle Integrative Oncology in Seattle with Dr. Jenna Bailey, and one of her patients has had this for 10 years and wears a sleeve and is out in the garden working all the time. But, you know, was telling Dr. Bailey that every once in a while, when they do family photos and stuff, she takes her afflicted arm and she puts it behind her back for photos. So just holding space, I think, is so important for the patients that are afflicted with lymphedema. So we, as naturopathic physicians, can, you know, give them a little extra care, like our training warrants. So the rest of the poster goes into some detail. There's a case study here on secondary lymphedema that we'll eventually submit for publication because we've had some really great integrative therapeutics through naturopathic specialists up in Scottsdale, Arizona. Dr. Dan Rubin, Dr. Melissa Coates helped with this patient's care. And we also got this patient involved with the Neil Rorden Center for Regenerative Medicine and some prolotherapy for concomitant osteoarthritis. I did borrow a lot of statistics from Dr. Neil McKinney's book and Dr. Palmer's books on oncology, and they're listed here. And then, because we never want to leave out homeopathy, I love the Banjari protocols out of India for some lymphedema-related homeopathic remedies that we can share there. And I think eventually, I think we're going to come to a day, hopefully, where we're not just surgeons in the medical field, or not just dissecting the axillary lymph nodes as part of like a breast cancer staging and we're really relying on like the liquid biopsies that are out there for our staging and our targeted therapies. But for now, that's still in the making, that a lot of like the guidelines, there are research-driven data surveys that, dissecting for biopsy purposes, the axillary lymph nodes and taking 20 or 30 samples and putting a patient at risk for down the line secondary lymphedema versus monitoring the staging progression of the disease through other avenues in the liquid biopsy world. We're seeing like the same results in some of those studies. So hopefully down the road, there'll be less lymphedema because our practices as diagnostics and staging will soon change. But until that time, I encourage all of you to find some really good certified lymphedema therapists out there. I think I'm not allowed to say here any specific names of organizations that certify these therapists, but LANA is the governing body for North America. So you definitely would like your therapist to be aware of the LANA certification when you're working with lymphatic massage therapists in this integrative setting. I want to throw it over in case Amy would like to unmute and share anything that I might have missed. Otherwise, I look forward to seeing all of you in Chicago at AANP. Thank you for your time and attention, and I hope that you come up and chat with us. If you have any questions about this poster, there are some naturopathic nutraceutical approaches that we've kind of put on here specifically to the ER/PR positive, HER2 negative space. And I would love to learn from all of you about your interactions with your patients that have struggled with lymphedema or any oncology stories that you'd like to share with me. I'm going to be starting my 2-year onc residency toward my FABNO with naturopathic specialists here in Scottsdale, Arizona, learning from Dr. Melissa Coates and Dr. Dan Rubin and their wonderful team. So, Amy, would you like to share anything?
No, I think that was great. I appreciate you for all the education.
Okay, thank you for contributing to the poster, and we will stop the recording here and upload this to Dropbox for everybody. Stop the recording. Pause, stop recording. You think, did it stop recording on your end?